Hey everybody, I'm gonna go over my research question based on my problem, my literature review, my proposed model and hypothesis, and also my research method, study design, and data collection. So the problem is only two gender options on an intake form or in the electronic health record system excludes transgender patients from patient-centered care. So the research question then is, would a third gender option in the electronic health record improve quality of care for transgender individuals? A lot of the research that I've done, as far as literature goes, there's stigma with treating the trans population. One of my sources said that 1 in 5 trans patients are turned away when seeking care. Different source said that 31% of trans people lack access to regular medical care, and 22% of trans people avoid care due to fearing that they will be discriminated against. And this is based on a population of about 0.6% of adults, or approximately 1.4 million trans people, and that those numbers are from 2021. So some of the things that have been studied are lab errors being reduced based on name, pronoun, or gender confirmation, like before the testing is done, or the label that's put on after the test is done. It seems that there has been no adverse effect when collecting sexual orientation and gender identity information. 70% of the people in that study chose the intake form as the method of disclosure for their gender identity or sexual orientation. Disclosing of a trans identity means that that person would have been more likely to have a health screening in the past 3 years. And then currently, the Institute of Medicine says that there's limited health data as far as transgender healthcare research goes. When cancer doctors were asked knowledge questions about trans patients, they only answered correctly 45.9% of the time. So as far as my proposed model and hypothesis, my hypothesis, and these are all measurable, is that patient approval rating would increase when a third gender option is implemented within the EHR. The second one is professionals' retrieval and understanding of gender and sex information would increase. And also, professionals would have more confidence in treating trans patients if a third gender was added to the electronic health record. So my method would be observational, because it's ethnography. There's a specific culture, so it's people who identify as trans would be the culture that I specifically focused on. And as far as design, it would be evaluation or a survey. I could track things such as appointment attendance after they had been given a third gender option on an intake form, and that was put into their EHR. How well or how easily accessible healthcare professionals feel that the information is, and their confidence in interpreting that information. and then the healthcare professional's confidence in treating the trans patient. I actually have a survey that I think 7 people now have responded to, so I'm waiting on some results from that, and then I'll be able to share. So, yeah, that's pretty much where I'm at as far as my research goes. I'm still looking for more sources. I have 15 right now. I'm trying to find a couple more good ones. So, yeah, if you guys have any questions, let me know. Thanks.